Hello everyone, welcome to this class on the occipital bone. Here you can see the occipital bone held in anatomical position. This circular opening is the foramen magnum. Behind the foramen magnum you have the squamous part. In front of the foramen magnum you have the basilar part, and on either sides you have the condylar parts. So in anatomical position the foramen magnum is kept horizontal with the squamous part behind and upward, and the basilar part forward and upward, and the foramen magnum horizontal with the condylar parts on the two sides. And the squamous part. The squamous part, as you can see, it has an internal surface and an external surface. So this is the external surface, this is the internal surface. Let us take a look at the external surface. So this is the external surface of the squamous part, and from here you can make out that you have a superior angle over here and you have a lateral angle over here, and from the superior to the lateral angle this is the superolateral border, and from the lateral angle to the jugular process over here you have an inferolateral border. Now up to the lateral angle, this entire articulation, it articulates with the posterior border of the parietal bone, forming a suture which is a fibrous joint, and this suture is the lambdoid suture, which is a type of suture known as the denticulate suture. And this position over here at the point of union between the occipital bones with the two parietal bones is called the lambda. It is the site of the posterior fontanelle in the newborn. And on this lambdoid suture you can make out this extra piece of bone which is trapped in the suture. This is called a sutural bone or a Wormian bone. So again, from the superior angle to the lateral angle is the parietal border, forming the lambdoid suture articulating with the posterior border of the parietal bone. From the lateral angle to the jugular process is the mastoid border articulating with the mastoid part of the temporal bone. And here you can see the condylar parts, and in front the basilar part. Now we will go into the details of the squamous part. Before that, you can make out, see, we have in this picture the parietal bone and the occipital bone, and we have shown you the articulation. And this is part of the lambdoid suture, inside which you can see this trapped sutural or Wormian bone. In this picture we have fitted the temporal bone, the right temporal bone, to the occipital bone, and here you can see the articulation with the mastoid part of the temporal bone from this point to this point, and this is the squamous part of the temporal bone, this is the petrous part of the temporal bone, this is the mastoid part of the temporal bone. So apart from the articulation with the mastoid part of the temporal bone, the petrous part also articulates with the sides, with the lateral margin of the basilar part, and this jugular process also articulates with the posterior end of the posterior border of the petrous part of the temporal bone. Let us now look at the squamous part of the occipital bone. This is a view of the posterior surface. The first thing that comes to mind is this elevation, roughly in the middle of the superior border, the superior angle and the posterior margin of the foramen magnum. This elevation is called the external occipital protuberance. From this elevation you have a ridge going down to the posterior margin of the foramen magnum, and this is called the external occipital crest. This external occipital protuberance as well as the external occipital crest gives attachment to a ligament called ligamentum nuchae. From the external occipital protuberance you can make out this line, the superior nuchal line on both sides. We have painted it on one side only, and to this superior nuchal line you can see the attachment of the trapezius muscle in the medial part, the medial 1/3, and laterally you can see the attachment of the sternocleidomastoid above and the splenius capitis below. Not only that, along the superior nuchal line you can make out this green structure, the investing layer of deep cervical fossa. It is attached to the superior nuchal lines, and that means that the portion below the superior nuchal line is part of the neck, and the portion above the superior nuchal line is part of the head, that is, it's part of the vault of the skull and it's part of the scalp. Now above the superior nuchal line you can make out another faint set of lines. These are called the highest nuchal lines, and to this highest nuchal line you have the attachment of a structure called the epicranial aponeurosis. This epicranial aponeurosis is a sheet of fibrous tissue which protects the scalp, and it has embedded muscle fibers in front and behind, the frontal belly in front and the occipital belly or the occipital bone. So these muscle fibers belong to the occipital belly of the occipitofrontalis, which are attached to the lateral part of the highest nuchal line. So highest nuchal line, superior nuchal line, trapezius, sternocleidomastoid, splenius capitis, investing layer of the deep cervical fascia. Now in the middle of the external occipital crest, you can make out another set of lines. These are called the inferior nuchal lines, and between the superior and inferior nuchal lines you have two muscles, medially the bulky splenius capitis and laterally the superior oblique. And below the inferior nuchal lines and between the inferior nuchal line and the margin of the foramen magnum, you have two muscles, medially the rectus capitis posterior minor and laterally the rectus capitis posterior major. And to the margin of the foramen magnum, you have the anterior and posterior atlanto-occipital membranes, which have come up from their attachments to the atlas. Now let us take a look at the inner surface of the squamous part of the occipital bone. Almost at the same level as the external occipital protuberance, you do have an internal occipital protuberance and an internal occipital crest. Now at the internal occipital protuberance, you can make out a cruciate grooves, one groove going above and two grooves on the sides. The groove that is going superiorly is actually the superior sagittal sulcus. Its margins give attachment to the fax cerebri, which is a fold of the meningeal layer of the dura mater, and the attached margin of the fax cerebri lodges the superior sagittal sinus. You can see the superior sagittal sinus. It is within the folds of the fax cerebri. Now this transverse groove is for the right and left transverse sinuses. The margins of the groove give attachment to another dural fold, which is called the tentorium cerebelli, and the margins split to give to lodge the transverse sinuses. You can make out here that the superior sagittal sinus is more in continuity with the right transverse sinus, and for your information, the straight sinus is more in continuity with the left transverse sinus. However, you do have a cross channel of communication, which is called the confluence of the sinus. So here you have internal occipital protuberance and the confluence of the sinuses. Passing downward from the internal occipital protuberance, you have the internal occipital crest, which gives attachment to the fax cerebelli. It's a dural fold between the two cerebellar hemispheres, and this fax cerebelli splits below to form the Warmian fossa, which lodges the inferior vermis of the cerebellum. And along this fax cerebelli, you have the occipital venous sinuses. So this is more or less what you need to know about the squamous part. In the next video, we'll go into the remaining parts of the occipital bone. Thank you.